Calling this meeting of the Special Committee of COVID-19 to order on February 2nd. Madam Clerk, please call the roll.
Alderwoman Davis. Alderman Vaquero.
Aye. Or present, I'm sorry, present.
Alderwoman Hubbard. Alderwoman Ingracia.
Present.
Alderwoman Murphy.
Here.
Alderman Coder.
Here.
Alderman Muhammad. Alderman Oldenburg.
Here.
Alderwoman Boyd.
Here.
Alderwoman Middlebrook. Alderwoman Clark Hubbard.
Here.
President Reed.
Here.
8 present, you have quorum.
All right, thank you.
And Muhammad's here.
And
Thank you.
Davis.
Got it. 10 present.
All right, thank you. Thanks to all of you for attending today's meeting. Let's go down to get my agenda. Madam Clerk, we'll move excused aldermen to the end of the agenda just to see who else shows up today. I'll entertain a motion for approval of the minutes.
I'll make a motion, we approve the minutes, and I don't know the date of our last meeting.
January 19th, 2021, moved by the alderman from the 23rd, seconded by the alderman from the 13th. Madam Clerk, please call the roll.
Alderwoman Davis.
Aye.
Alderman Vaquero.
Aye.
Alderwoman Hubbard. Alderwoman Ingracia.
Aye.
Alderwoman Murphy.
Aye.
Alderman Coder.
Aye.
Alderman Muhammad. Alderman Oldenburg.
Aye.
Alderwoman Boyd.
Aye.
Alderwoman Middlebrook. Alderwoman Clark Hubbard.
Aye.
President Reed.
Aye.
Alderwoman Hubbard. Alderman Muhammad.
You're muted, Alderman Muhammad.
Aye.
Thank you. Alderwoman Middlebrook. 10 aye votes.
By vote, stay in the motion and approve the minutes of January 19th, 2021. We will dispense with line items 5 and 6. Items up for discussion. Item number 1, discussion about the distribution of vaccines with representatives from the mayor's office. And I believe we have Dr. Echols in attendance. And I believe we also may have Steve Conway from the mayor's office. I saw a little bit earlier. Dr. Echols, could you give us an update on the distribution of the vaccines, what's been done currently,
Sure.
what the plans are moving forward, and give us just an overall overview.
President Reed and the coronavirus committee, thank you all for this opportunity to shed light on the activities that the City of St. Louis Department of Health have conducted to ensure compliance with the state's vaccine distribution rollout, as well as communication with stakeholders across the City of St. Louis. So as you all know, there was a delay in the City of St. Louis receiving a COVID-19 vaccine. However, during that time, while we were waiting to receive vaccine, we continued to work with agencies across the City of St. Louis, and we engaged them by having ongoing discussions, but also requesting that they provide a roster to the City of St. Louis Department of Health that included the name and information for all of their staff, but then they also highlighted the staff that desired to receive the vaccine. That way we were able to properly allocate vaccine for particular agencies, and that also helped with planning. As you all know, one of the challenges with the current vaccine that have been approved by the Food and Drug Administration under their emergency use authorization authority is that there's strict cold chain requirements. And so if we don't adhere to those cold chain requirements, we have the potential for wasting vaccine. And so with that, for the health department, that was not an option. And so while we were waiting to receive vaccine, we felt like it was important and necessary for us to obtain as much information as we could from our stakeholders and partners, and add that information to our database so that when certain groups were eligible to receive the vaccine, we will be able to distribute the vaccine in an organized and responsible fashion. Last week, the city of St. Louis did receive its first allocation of COVID-19 vaccine. We received approximately 3,900 doses of Pfizer vaccine from the state of Missouri. The week prior to that, we were allocated 400 doses of Pfizer vaccine from Barnes-Jewish Hospital to help us start the vaccination process for our first responders. So the first 400 doses went to the fire and EMS department. We were able to vaccinate approximately 442 of our fire and EMS department staff the week prior. Then we also received some support from St. Alexis Hospital, where they vaccinated, I believe, around 200 of our fire and EMS staff. So while we were waiting to get our own allocation, our community stakeholders actually provided some support and assistance to help us start the process. The priority groups that we identified for the first COVID-19 vaccination events were in compliance with the state's requirements. So we wanted to make sure that those organizations that were at highest risk within the city of being exposed to SARS-CoV-2, the virus that causes COVID-19, wanted to make sure that they had opportunities to receive the vaccine. So we worked really closely with the Division of Public Safety, Judge Jimmy Edwards, as well as his staff, Chief Hayden and Chief Jenkinson, to get rosters for their organization so that we had a working list and we knew how much vaccine to allocate for the vaccine distribution clinic. And so on day one of our vaccine clinic, which was held on January 28th, we were able to vaccinate 988 individuals. That wasn't enough to cover everyone, but based on the individuals that were available to come to that particular event, we were able to vaccinate 988 individuals. On day two, which is January 29th, we were able to vaccinate 1,716 individuals who were within that category. But then we found out that we were close to completing the vaccination process for our police department and our fire and EMS department. So at that point, we made a decision to reach out to other agencies who were eligible to receive the vaccine. So the City of St. Louis Department of Health, we had a working list, as I mentioned before, of over 60 agencies that were either in the 1A category, meaning that they're patient-facing healthcare providers, EMS staff, and we also worked with Valerie Russell in the Department of Human Services to identify those other individuals who are acting on behalf of the Health Department and Department of Human Services to provide homeless services for individuals in the city of St. Louis. And so in total, there were 60 agencies that we contacted because they met the eligibility criteria. That accounted for 1,027 individuals that came through our line. So again, on January 29th, 1,716 individuals were vaccinated, and then on January 30th, which is last Saturday, 1,794 individuals received the COVID-19 vaccine, bringing our 3-day total to 4,498 individuals that we were able to vaccinate, at least give their first dose of the COVID-19 vaccine. For the housing agencies that participated, we worked with those that were contracted by the City of St. Louis to conduct housing services. We knew that, again, this isn't enough to cover everyone, but we wanted to cover as many people as we could. On Thursday, we also took an additional step further, and we also used the information that was available through the registration process that we created on the city's website. We wanted to make sure that we were also using that information to identify those individuals who are eligible to receive the vaccine. And so we ran a report to identify those individuals who were eligible. So we sent out an email blast to about 1,000 individuals who were eligible to receive the vaccine. That was based off of the information that they provided when they completed the survey. One of the changes that we had to make in the survey after the first iteration was published was the BMI criteria. So initially, during the first iteration of the survey, the BMI threshold was a BMI of 30. So according to national standards, having a BMI of 30 indicates obesity. And so that is one of the risk factors associated with having severe complications with COVID-19. However, the state's threshold was 40. So after the first iteration, we revised the survey to, but when we ran the report, some of the individuals that indicated that they had a BMI of 30 were included in the list that we send the email out to. So that in some cases, people didn't think that met eligibility criteria. That wasn't a condition that made them eligible, but according to our first iteration, it did. And so we worked out those kinks, but for those individuals who met the criteria, we didn't ban them from receiving the vaccine. We actually allowed them to go through the vaccination process during those days. And so again, over the course of the 3 days, we vaccinated 4,498 individuals. We've also been working with the state really closely to make sure, again, we're complying with what their requirements are, because if we fail to comply with the state's vaccine distribution plan, then we can put ourselves at risk for not receiving additional vaccine. And again, that's not an option for the City of St. Louis Department of Health. And so we're working really closely with the state to make sure we're communicating with them regularly, and we're aware of what allocation of vaccine we'll be receiving as well. And so as we move forward in this process, our ultimate goal is to, again, make sure we continue to comply with the state's requirements. We also want to make sure we are implementing an efficient approach. And so by continuing to work with organizations and stakeholders across the City of St. Louis, we're still receiving rosters from individuals who desire to receive the vaccine. Again, that helps with planning. But another thing that we're also doing is establishing priorities or establishing solutions for priorities that may be difficult to reach. For example, the homebound population. These are individuals who, for whatever reason, are not able to come to our vaccination site. And so we've already started working with the Department of Human Services, their Agency on Aging, to identify individuals who are on their functional needs registry. And we're also asking individuals if they have access to internet, if they can complete the registration form that has been published on the city's website. And we're also taking individuals' information as they call into the health department. So individuals who may not have access to internet or a smartphone, et cetera. When individuals call to the health department, we have a staff that's available that will take their information down. And in some cases, we actually walk them through the survey and complete it for them to make sure that their information is entered. But we've also started having discussions with the City Emergency Management Agency and FEMA. So FEMA is willing to, it's indicated they're willing to provide a mobile unit in the City of St. Louis, and that will help us go out to these areas where individuals are homebound or may not be able to leave their residence for whatever reason. And we want to make sure that those individuals are not left out. We want to make sure that everyone has access to the vaccine resources that we're securing from the state. And so we've already started working with partners to identify staffing for the mobile vehicle, so that when we actually receive it, we can start getting vaccine out as quickly as possible. And that's kind of where we are right now. The state has indicated that we will receive 975 doses of Pfizer vaccine in the City of St. Louis. And so we've already started having discussions about how we will prioritize those doses. And what we're looking at is the individuals that have registered in the city's database. So particularly, we're looking at those individuals who are age 65 and older with underlying medical conditions, because they are at higher risk for not only experiencing complications from COVID-19, but they have the highest risk for actually dying from COVID. And so we want to make sure those individuals are prioritized. So that group will be the priority focus for these 975 doses that we plan to receive today.
All right. Thank you, Dr. Echols. Let me just ask a couple of questions. So The body mass index was one of the indicators that you all used on that online application.
Yes.
So if someone, even if they had a 20% body mass index, but they don't know, they say, okay, do you have a 30 or 40? They could just say yes, right? But you wouldn't, there's nothing to verify or validate that. Is
Well,
that-
so that's a great question. So now that gives me an opportunity to kind of walk you through the screening, the process when individuals enter the vaccine site. So as the individual enters the vaccine site, they're met by a greeter. Then the greeter directs them to the screening table. So when the individuals go to the screening table, we verify the information that they provided to make sure they're on the list. And so one of the things that did happen over the past week, so individuals who didn't think they had an underlying medical condition, but they marked it on their form. When they got to us and they said, "Well, I don't have I'm not obese. I don't have any underlying medical conditions." At that point, we had to turn them away because they didn't meet the eligibility criteria. So, but for those who did meet the eligibility criteria, they were then allowed to proceed to receive a clipboard and a consent form, which has to be filled out before they go into the vaccination area. Once they enter the vaccination area, they are assigned to a station which has a vaccinator and a scribe. Initially, the information is verified, so they go through each of the questions that the patient has that fills out on the form to make sure that it's accurate, and also want to make sure the name and date of birth and all that information is accurate, as well as their contact information. So after that information is verified, they go over the potential side effects of the receiving the vaccine, have those discussions with them. If there's any question that needs additional clarification, that's also done at that time. For example, if someone mentioned that, hey, I think I had a severe adverse reaction to a vaccine in the past, we ask follow-up questions to that. Okay, what exactly did you experience? Did it require hospitalization? Did it not require hospitalization? To get more information about what symptoms that individual actually had. After the individual is cleared, then the vaccine is administered, and then the individual is allowed to go to an observation room where they're observed by EMT staff for roughly at least 15 minutes. And then after the 15 minutes, if they're fine, then they're allowed to exit the area and proceed with their daily activities.
So if someone shows up and they say they have diabetes, and that's one of the things that they say, the validation of that happens when again?
At the screening process.
At the screening process. So
Right.
the screening process, how do you validate it again?
So some people will say, okay, I don't have any underlying medical conditions, and other people will
let's assume for a second that a person is saying, okay, I'm obese because I'm 30%, BMI or 40% BMI, and also say that they have diabetes or a heart condition or whatever. Is it just based on their word through that screening process, or do they have to have some medical record or something from a doctor or something that says yes, they are diabetic or whatever?
So one of the things that we advise everyone to do is to be honest when they're completing the survey, because we do have a limited quantity of vaccine. And so we aren't checking individuals' hemoglobin A1C or doing, we don't have glucometers on site and those types of things. So we really need individuals to be honest when they come to the vaccination sites, because we do have a very limited supply of COVID-19 vaccine, and we need to make sure that those individuals who are indeed have the highest risk are able to receive it before the general population. So we're asking again, everyone that completes the survey, we need them to do it and be honest when they're completing the survey, and when they arrive on site, just also be honest in their responses, so that we can make sure we're utilizing the resources as appropriately as possible.
And how are you prioritizing vaccinations for overall frontline workers, not just, healthcare workers and public safety workers, but overall frontline employees, people that are performing jobs that put them in that high risk category. How are you prioritizing them, above some of the other general population?
So we're following this, the state's guidelines. So on January 14th, 2021, Dr. Randall Williams with the Missouri Department of Health and Senior Services issued the state's tiered approach. And so we're following that tiered approach here in the city of St. Louis. And that helps make sure that there's a standardized approach, not only in the city, but across the state of Missouri as it relates to the rollout of vaccine.
All right. We heard a lot of, discussions and things throughout the community about young, healthy people getting vaccinations, at the site. So how do you answer that? And what can we do about that? Like, for example, one example was, a guy named Richard Callow, said he got an email, so he went to the site and got vaccinated. And we also heard stories of younger, healthier people getting vaccinated. We know all of our seniors throughout our senior centers have not been vaccinated. People with extreme underlying conditions across the city haven't been vaccinated. And there are a lot of people with a 30% BMI, 35, 40% BMI that can appear very, very healthy and fit. Right, depends on how their body structure plays a big role in that also. How are you guys categorizing and assuring that the people who are most in need actually gets the vaccine first and foremost, and that technology isn't playing a role in preventing them from being able to register online and some of these other things, right? And also information, because the average person out there, they have no idea how to even begin and where to go get it.
For the priority, so we looked for the BMI issue. So we've already revised the survey that's online. So the requirement is BMI of greater than 40.
Here's the challenge with that. The average person wouldn't have any idea what their BMI is. They wouldn't have any idea, so they'd just be guessing, right? Unless they go to a fitness place or something like that and get it checked, and you can get it in a water tank or just a little clip monitor where they test it, like at a pinch test. So I think that's one of those things that, I don't know who, there has to be a very small segment of the population that knows what their BMI is. So that'd be a total guess for the average person, I would assume.
Well, some individuals know, but then we also have those other conditions that are also listed. So, chronic kidney disease, immunosuppression, diabetes, and other illnesses that are also listed. So we prioritize based on how individuals complete the survey, but we also have another tier. So we're looking at those individuals who are above that age threshold. So those who are 65 and older and have underlying medical conditions, which again are the individuals who are have the highest risk. But we also have those individuals who remain in tier 1A or phase 1A, who are the healthcare providers who were the initial group that was prioritized by the state because they're patient facing. They have the highest risk of being exposed to SARS-CoV-2 because of their line of work. So we still have individuals in that group who may appear healthy, but still are eligible to receive the vaccine because they are healthcare providers. So this includes, so our focus for the healthcare providers with those individuals who are working in the healthcare field, but they aren't associated with the hospital system. So this includes dental offices, private medical offices, chiropractor offices, and other home health care workers, et cetera. So there's still quite a few of them that are eligible, but they also may appear, a lot of them are healthy, but because of their line of work, they're eligible to receive the vaccine. And so that's another factor that it may appear like a lot of people who are healthy are receiving it, but because of the line of work, they're eligible to receive it at this time. And again, the healthcare workers were the first group that were eligible, not only in the state of Missouri, but across the nation to receive the COVID-19 vaccine because of their scope of work.
Yeah, and how many people have signed up online?
In total, we've have over 30,000. And when we did the last, when we did
30,000 that signed up in the city?
in the city, and of that, over 12,000 were individuals over the age of 65.
Okay, so 12,000 over the age of 65, and of those 12,000, maybe a couple thousand of them have been vaccinated currently. Okay, and then
And here's one other thing. So there was also a program that the state was running with the private pharmacy. So the state partnered with Walgreens and CVS, and their particular project was for the private pharmacies to go to the long-term care facilities and those currently living facilities where elderly individuals are housed to administer the vaccine to them. That rollout has been extremely slow in the city of St. Louis, and so some of the medical agencies in the city have actually been going to those sites to provide vaccines, such as the FQHCs. Some of the FQHCs have been bridging that gap in the city of St. Louis, and so we're still working with the state to see how we can get the private pharmacies to really go into the long-term care facilities to make sure that those individuals receive the vaccine and the appropriate second dose.
so how are we going to address the mobility issues for people so that we have vaccination sites set up, throughout communities all across the city? So, like, for example, there are a lot of places in North St. Louis where you do not have a CVS pharmacy or a Walgreens pharmacy. So how are we going to address some of those issues so that people throughout the city, no matter where you live, you still have a place to get to and be able to be vaccinated?
Right, so that's one of the role for the FEMA mobile unit, which we'll be able to use to go out and provide vaccine to individuals who are homebound or individuals who just weren't able to leave their home to receive the vaccine. So that'll be one approach, and then we'll also be looking to identify other sites in North City and South City where we can go and have vaccination clinics. Because to your point, we need to make sure that there's not only equitable distribution of vaccine, but equitable access. So making sure individuals across the city of St. Louis have the same opportunity to receive the vaccine. And again, what the COVID-19 pandemic has shed light on is a lot of the pre-existing issues that I won't say they weren't adequately addressed. And so the IT infrastructure and notification for elderly and homebound individuals, as well as increasing access points just for medical and health related services in general, has been lacking. And so this gives us an opportunity to not only bridge that gap for COVID-19, but identify solutions so that individuals in those communities can have access to health resources beyond the COVID-19 pandemic, because that's really what's needed if we are serious about changing the trajectory of health in the city of St. Louis. I often reflect on the city and county health rankings that's issued by the Robert Wood Johnson Foundation, and in the city of St. Louis, out of the 115 jurisdictions in the state of Missouri, the city of St. Louis ranked 112th for health outcomes. And so we have more medical providers per square area than any other jurisdiction in the state. And so that's alarming to know that we have such poor health outcomes, but we have a lot of medical providers. So we have to really look at not only creating equitable access and creating equitable opportunities, but we also have to work to pursue health justice, which means that we are proactively acting to remove the barriers that are preventing individuals from receiving these services. And those barriers could be lack of cultural sensitivity among providers. It could be lack of transportation. It could be violence in their area. So there's a lot of issues that we have to really focus on. I'm thinking, and then with the City of St. Louis Department of Health, we're trying to not just develop tunnel vision and focus on COVID-19, but there's a bigger picture that we have to pay attention to, and that's health injustice that has really plagued every community in the city of St. Louis. And as I tell my staff, we have an opportunity now to do things different, to change the paradigm, to change the narrative in our jurisdiction. And if we don't take this opportunity to do it now, that alone would be tragic.
Why are hospitals getting 53% of the vaccine?
So that's a question I don't have an answer to, and that's a decision that's made at the state level. When we asked the state about how jurisdictions were allocated a particular quantity, we did that wasn't a response, and we haven't received that response yet. So unfortunately, I don't have the answer for that. I know that early on in December, when the first allocations were received by the state, the focus was hospital systems because they had the largest number of individuals who were at increased risk for being exposed to SARS-CoV-2 because of their line of work. And so we needed to do everything in our power to preserve our hospital system so that they could continue to provide the essential health services for individuals that need it. So that goes beyond COVID-19, but for individuals who may have a heart attack or a stroke, who may go into diabetic ketoacidosis, they need critical medical services. And so that was really necessary at the beginning. And so that's why hospital systems were prioritized early on. But as they've rolled out the vaccine distribution, roll out the vaccine amongst their employees, I think some of them are at this point in time are able to and have started administering vaccine to individuals outside of that group. For example, with Barnes-Jewish Hospital and I believe Mercy and SSM, they've been looking at their patient roster to identify those individuals who are 65 and older who have underlying medical conditions, because a lot of them are already in their system. And so they have a way to contact those individuals to get them in and get them vaccinated more efficiently than some of the health departments and even the FQHCs can do. And so that's another opportunity where the hospital systems have been helping to lift this very critical work.
All right, thank you for that answer. And finally, we heard yesterday that the state is putting St. Louis County in charge of the distribution of vaccinations in St. Louis County and St. Louis City. And I can tell you that alarms me completely. I have no idea how the state could think that's a good idea. Have you all been in conversations with the state at all, or was this a unilateral decision that you found out yesterday also?
So it was a decision that I wasn't privy to until after the decision was made. And so we do work really closely with the county. But however, my understanding from the state is that we'll still be responsible for submitting our weekly request for COVID-19 vaccine, and they will roll out the vaccine.
Do we submit it to St. Louis County or to the state?
Directly to the state.
And then the state gives it to St. Louis County, and then it's up to St. Louis County to oversee the program in the city and the county?
No, so I'll submit the vaccine request to the state, and the state will will issue that allocation to the City of St. Louis Department of Health. So I think that I'm not sure how well thought out the plan was for the regional.
It wasn't planned out well. It really wasn't planned out well. Where the City of St. Louis, who I think we have in terms of the complexity of the populations and being able to assure that the people in the City of St. Louis get equal and unfettered access to the vaccines. I don't understand how it makes it more efficient and effective that St. Louis County oversees that. I have no idea. That is beyond me.
So in short, I'll say the vaccine request as well as the vaccine distribution that's up to the City of St. Louis Department of Health. So that chain of communication between the line of communication between the City of St. Louis and the Missouri Department of Health and Senior Services, that still remains intact. And that's the only way that we can get our own allocation, because we are established as a COVID-19.
So what role does St. Louis County play then?
That's a great question. Yeah,
because what you're saying is what the picture you're painting is what our assumption would be, is that we are working directly with the state and we get our own allocations and we can administer them and distribute them based on our plan here in the city. But from what I'm hearing coming from the state, that is not going to be the case. Or there just seems to be some gray area there that I think we need to get ironed out. And I would not be in support of, in no way, shape, or form, of a plan that requires us to rely on St. Louis County to administer or set out a plan to assure that the people in the city of St. Louis get clean and equal access to the vaccines in the city. I think they have enough to worry about in the county, so they should worry about that population, about county, and
but I will assure you, so the line of communication between myself and Director Williams and his executive leadership team is open. It remains open. We communicate regularly to ensure that we're receiving our appropriate allocation of COVID-19 vaccine, as well as that we receive additional resources. So everything else that happens, some of that is out of my control, but my responsibility is, again, making sure that we're doing our very best to get as many resources as we can for the city of St. Louis residents.
Okay, Dr. Eccles. Okay, thank you. We're getting kind of long. I want to get to some of the other questions, but some of the aldermen. But thanks, Alderwoman Davis.
Mr. President, I thank you for allowing us to ask questions. Dr. Eccles, one of the things that I had concern about with some of the residents that were calling me complaining is that because all of these different entities are putting out different information about how to ascertain the vaccine, they're at a loss. And so what they do is they just register with everything they can find, which is not helping us when we're identifying how much vaccine we actually have available. So how do we work on that?
Right, and that's, again, that's one of the gaps that has been identified and, I guess, in some ways highlighted over the last few weeks. And so one of the things that we wanted to do in the city was make sure we had a platform for city residents to go to register to receive the vaccine. And so, but we also want to make sure that was a way for us to communicate back to them, not just collect their information. How do we reach back out to them and say, okay, now you're eligible based on the information you provided, and you can come and receive the vaccine on at X date at X location. And so that's what we've been doing. We started that process again last week when we ran the first report and sent out the email to those individuals who were eligible based on the information that they submitted in the survey. The system isn't perfect. We acknowledge that, but I think the lack of a standardized approach, not only across the region but across the state, has really and across the federal level. So we're still cleaning up a lot of what happened during the early on during the pandemic. And so, but what we have to do now is really utilize the resources and tools that we've put out there as best we can. But we also have to do so in a way that's sensitive to our community's needs. And so by creating that feedback loop to those individuals in the city of St. Louis, it was really critical for us. And so at this point, think that seems to be working okay, but there's always room for improvement. And as we go through the pandemic, we'll be looking to make additional adjustments and tweaks to improve the efficiency and effectiveness of our programs.
Okay, so one of the things I wanted to ask about also is if we could do more advertising about the delays and the shortcomings of the vaccines that are available, because people believe that there are hundreds of thousands of things sitting there waiting, and why can't they get it? And when you only talk about less than 5,000, that's nothing compared to what we need for the city of St. Louis. And that's happening all over the country. And so if you know, or if they've shared with you all about when they anticipate this additional large amount that's going to be distributed that was just ordered, is it going to be a month, 2 months? Did they even share that with you all?
So I'll walk through the ordering process. So we order vaccine each week. The order, the state of Missouri collects that information Monday through Wednesday, then they compile the information on Thursday and Friday, and then they actually place the order on Saturday. And so we typically don't know how much we're going to get until they actually place the order. Sometimes we don't find out that information until Monday of the following week, but typically we will receive the our allocation of vaccine on Tuesday, based on the way the state has organized that process. And so there isn't a lot of lead time, and so that's why planning ahead of time is really important, so that we have working list of individuals, we know who are eligible, as well as we have the registration information from individuals who that includes information on individuals who have completed the survey online. And so the emergency preparedness program at the health department has been working tirelessly to make sure we have an organized approach for vaccine distribution. And by collecting information, reaching out to stakeholders early on and collecting their information in an organized fashion has helped us better position ourselves to have an efficient rollout.
Okay, and my last question is,
Alderwoman Davis, you're muted. There you go.
I
You said your
lost
last
you.
question is,
My
and-
bad. Okay, I lost you.
there you
So,
start over with your
wanted to-
question.
yeah, so I wanted to ask you if we could advertise it a little bit more for those people who have folks that really are bedridden to some degree, and or just very limited mobility. And you said a van can come and somebody can provide it at their home?
So we're working with FEMA to get the mobile unit in the city of St. Louis, and that'll be used to go out to individuals' homes where they're homebound. But one thing we have to be mindful of is the cold chain requirements. So after the vaccine is reconstituted, you have a very short amount of time between, from when it's reconstituted and it goes bad. So if we miss that opportunity, then we waste vaccine. That's also not an option for us. So we're being very mindful of how we can efficiently roll out the mobile vaccine administration process.
Do we have any of the facilities that are providing have where you can just drive up and they can do it in the car?
So we aren't promoting that in the city of St. Louis, one, because these vaccines are new. And so one thing that you have to think about as well is the liability. So if we give a vaccine to someone and then they have a severe reaction after they leave the site, let's say we've monitored them for 15 minutes, but they have a severe reaction at minute 30 or minute 31, we're liable for that. And so we are adamant about making sure that we have people complete the proper observation after they receive the vaccine. And so until we know more about these vaccines, we will not be implementing drive-through vaccinations.
Okay. All right. That's it for me, sir. Thank you.
All right. Alderman Vaquero. You're muted.
Let me turn this one off. Okay, I'm sorry. That started ringing at the exact same time. I have a few questions, actually. One, I guess, has to do with so the 4,000 plus people that came in the other day over the weekend, what was the racial makeup of that group?
So the majority of individuals, so that's something that we have to look at. So we have the forms that were filled out. So we have to go through those forms to make sure we're providing accurate information. So I don't want to give you a bad statistic. So we have to sort through all 4,498 forms, because we did collect race and ethnicity information for individuals that came through the line.
Right. Okay. So then, just two more real quick questions. One, the people that came through, which I actually qualified with the age, diabetes, and everything else. They tell you come back in 2021 or 20, whatever day. They give you a date in the future. Are they going to have the vaccine for all those people? They're going to have 4,000 vaccines for everybody to get their second shots?
Yeah, so we confirmed that with the state yesterday. So the state has promised us that we will have enough for the second dose to administer the second dose to everyone that has received the vaccine.
Okay, then my other thing, and I had talked to President Reed, we actually had a little conversation about this morning. A lot of people, so the only way that this was communicated was with emails. People signed up online, or I guess if I paid attention earlier, you said they could have called in, but how were the only way that I know, how were the people notified? I got a lot of calls that people saw it on TV and said, well, gee, why didn't I, how come I couldn't sign up, or what are we doing to actually, I mean, is there something that we could be doing or should be doing to say, gee, if you don't have a computer, tell your neighbor about this. Here's a phone number, and we're going to call those people to let them know. This was something that, like I said, the president talked to me about it this morning, and about the access for the people that are not computer literate or don't have computers, don't have access to the internet. What do we got planned that we can somehow get the message out, at the same time let those people know? Are we prepared to call 1,000 people in one day and say, hey, look, or can we do this through a robocall system to say, this is your eligible day and time? I mean, it's just, I guess that's my concern. Is I had people that were calling me that were elderly, that have no, they saw it on TV and they're like, well, Joe, you didn't tell us. And I'm like, well, first off, I didn't even know. I got it on an email like other people, and I filled it out, and I got the heart bypass, diabetes, I'm over 65. I got high blood pressure, I'd rather not have all that stuff. But, but I filled it out online, but how would an individual, I mean, what are we doing, or what can we do, or what can the Board of Aldermen do to assist in making sure people that don't have access to internet? I guess that would be my question.
Yeah, so that's something we've been developing a structure around for the last few weeks. And so we've been working with the City Emergency Management Agency, as well as St. Louis Area on Aging, as well as other communication specialists, to make sure there's a platform in place. However, when we put out information about a vaccine event, we have to be very mindful of what the type of the consequence of that. So if we know we don't have a lot of vaccine, that can create additional anxiety, additional issues. So by really implementing a targeted approach helps us make sure that we are properly utilizing the resources that we have and not causing undue stress for the community, because a lot of people want the vaccine, but as they talk about at the federal level and the state level, the amount of vaccine that is being received, not only in the state of Missouri, but in other states, is not sufficient to meet the demand. So we don't have enough to just administer vaccine to the general public. And so we're asking individuals who aren't eligible right now, and those individuals who may not get called right now, to just be patient with us. We're advocating on their behalf to get as many vaccine doses to the city of St. Louis as possible, but we also want to make sure that we are properly managing that resource, so none of it is wasted. And so,
but it still doesn't. Okay, I'm 80 years old, I'm very sick. I want the vaccine. I don't have a computer. How do I? I guess the question is, how does that person get notified? I can tell you that, like I had people that were in their 70s and 80s that signed up and drove out to Cape Girardeau because they gave them an exact time. Now, but they had access to a computer. But I also had people that called that saw the news with all the people lined up and said, why wasn't I notified? The question I'm posing has more to do with again, I'm 80 years old. I don't have a computer. I'm not even that good with the telephone, but I do have all the needs. How do I let you know that I want you to do that? And then how are you going to notify me when the only way you can notify me is by phone? And can you leave me a message?
All right, so one thing that has been happening is, so for individuals who are elderly and may not have communication, their family members have advocated for them. And so we've been working with the family members. Oftentimes those individuals will either need their family members to take them to the site or make arrangements for someone to come to their home. And so we've been working, that has been one mechanism. But again, we're building a structure around this. But if individuals do have a phone, they can call the health department at 314-657-1499, and we have staff that will assist them with getting registered and take their information. So again, they can call the health department's hotline at 314-657-1499. And when we fine tune the solution for reaching this particular population, we'll make sure that information goes out as widely as possible.
I mean, but I would think that you might want to advertise that number now, just saying, you need to be in this group to qualify, but, I would think, I would think that, I mean, if we're going to target the most vulnerable and target the parts of the community where the coronavirus has really done a lot of damage, and we've seen a lot of sickness and death, I would think I think we would want some sort of way, at least over there, even if it's a flyer or something that says, if you fall within this group, call this number, or we can, I'm just trying to think outside the box. I realize this is not an easy thing, and I thought you guys did a great job at Union Station. I thought that worked out really well. I'm just more advocating for the homeless, the people, the older. I shouldn't say old because I'm an old people, but the people that are elderly that their niece lives in California, or I mean that's I don't know if there's an answer, but I certainly think we need to work on one, that we get some sort of message out in these communities, say we'll let you know when your group's eligible, but if you fall within this group on TV, if you fall in this group, you are eligible to now call to set up to get on the list, and we will notify you when your time comes up. We don't have to open it to the whole everybody. And when we can be very specific, so somebody calls us, I'd like to get on the list. I'm 25 years old. And you say, well, call us back when you're not eligible right now. And, have people bring anything that says they're, in a certain age group. But I think at some point, other areas, like I said, I can only go for Cape Girardeau because I had people that drove out there. They just piled in a car and went out there. But they were given, you had to give them your age. You had to bring your ID to prove you were that age. And they gave you a very specific time. It wasn't like a range. It was a time. And that's out there in Cape. I'm just saying we need to really figure out in areas and even in my area, the TV, people watch TV. If you talk to the news channels, put something out that says very specifically, you got to be in this age group. Don't call us if you're not. But if you fall with this age group, call us. Anyway, I'm going to back off.
Okay. Dr. Echols, answer the response.
Yes, so we have solutions that we're putting into place, but for the individuals who don't have internet access, access to a smartphone or tablet, they can call the health department at the numbers that I mentioned before. So we've been advertising that widely. So all the town hall meetings that we participate in, as well as to our other stakeholder groups, our partner agencies, so they're aware of that as well. And so the information is getting out because people are calling us, and we're also mindful of the support network that those individuals may have in place. For example, a son or daughter may be the one that serves as the primary caregiver, the medical liaison for an individual. And so working with them to make sure that the individual has, if they can bring them transportation to the site, or if they need to have someone come to their home, making arrangements for that. And so that's the mobile component of our vaccination distribution is something that we'll be working with FEMA on.
All right, hey, Dr. Echols, could you submit a written plan so that we have a copy of it? And if you can get it to me, I'll make sure it's distributed to the committee. How the mobile vaccination is going to work, how we're going to address the issues of ensuring that our seniors and people with mobility issues get vaccination. How we're going to assure that the people who should be prioritized are prioritized to answer some of the questions that we've already had. So make sure you submit that to us. Alderwoman Tamika Hubbard. Alderwoman Tamika Hubbard. Alderwoman Ingracia.
Thank you, Mr. Chairman. Dr. Echols, thanks as always for spending some time with us. I've got a handful of questions. I, like so many other aldermen, was contacted starting on Friday night and through the weekend with a number of concerned residents. And so I'm hoping, I guess, first of all, a comment that I know that aldermen don't need to know every single thing that's happening as it happens in the moment, but for a rollout like this, the amount of time that I spent trying to get answers for residents over the weekend was really concerning to me, especially because there didn't seem to be a way for them to contact the health department to ask those questions themselves. And because aldermen weren't proactively communicated with, I was at a real loss of how to answer those questions. I tried to reach out to both you and the mayor directly. I realized that you were very busy when I couldn't get answers from folks maybe underneath where you are in your positions. And so I'm hoping that at the very least, we can have some better communication in terms of future rollout. But can you walk me through sort of what the platform looks like and what the scorecard looks like in terms of how you are filtering to make sure that we're sending out notifications to the correct people?
Yes, so when people register, so we use a platform called Qualtrics. So we've used that for other public health projects. And so the information is compiled in a spreadsheet. And so we're able to query that spreadsheet and draft reports, and we're able to limit or exclude populations based on the information that they provided. And so, for example, we're able to narrow it down to individuals over the age of 65 who have underlying medical conditions. We're also able to query that by date. So we're prioritizing individuals based on we can prioritize individuals by according to the date that they submitted their response, so that those who submitted the response first can be contacted first. So there's a lot of different ways that we can build our reports, but the information is based off of the information that the individual provides when they complete the survey.
Okay, could you provide this committee with the appropriate health information protected redacted so that we understand who was contacted via email on Friday? Because I definitely think that this is not, an anecdote or a one-on. There were definitely issues with people that I know that I trust that said they checked absolutely no boxes for age or underlying health conditions, but still went down and got vaccinated. A number of other people were turned away, even though they were contacted because they had checked no boxes, I guess, during the screening process. And then folks who signed up on the first day who have both age and health conditions that were not contacted. So is that something that you can provide to this committee?
So redacting all the information.
The health, not the contact information. So we don't know who the person is or where they live, but we can see those 1,000 people who were contacted by the city on Friday. what boxes were checked off that they qualified under the tiers that we're supposed to be vaccinating under. Is that something you can give us?
Well, I'm not sure how beneficial that'll be because you won't have their name or their contact information or the address.
I don't need to know who they are. I just need to know why they qualified. So is that something you think you can provide us or no?
Sure.
Okay, I appreciate that. About how long do you think it'll take to get that information?
You can give me a couple of days. I'll submit it to President Reed.
Okay, that's great. And then can you include, I'm assuming the racial breakdown is also in a spreadsheet somewhere from the screening process. Is that something you can provide at the same time?
That'll take, we have almost 400 to 500 sheets to go through. So that may take us a little bit more time, but we'll.
Okay, so it's all handwritten. It's not in like a computer software program. Okay, and then in terms of the accommodations, isn't there a way that you could possibly have people be able to drive up and then require them to wait the 15 minutes or 20 minutes to make sure that they're, the city, I understand that there's liability issues there, but it would, seem to me like we could be doing something a bit differently to help folks who can't stand in line for hours at a time.
Well, I guess so for drive-up vaccination, so one thing we have to be mindful of again is, all we need is one person to have a severe adverse reaction in their car. And think about having an EMT trying to get someone out of their car while they're having a severe adverse reaction. That's something we're not willing to risk. And so by having them come and sit in the observation area where their EMT is readily available to provide them with the medical support that they need is really critical. If this was a vaccine that we knew a lot about, had a lot of years of data for administration, then, that's one thing, but these are all very new vaccines. So we're not willing to take.
No, I appreciate that. I guess in my mind, there's probably a more thoughtful way to help those who, can't stand for long periods of time using canes or wheelchairs or things like that. My other question is, St. Louis County and St. Charles County received their first round of vaccinations the beginning of January, and St. Louis City received ours just this last week. Can you walk us through the process of how you have to request those vaccinations from them? And if something happened in the city of St. Louis, I'm also concerned, as President Reed mentioned, that St. Louis County is now over St. Louis City's allocation of a vaccine. So just trying to figure out what happened there.
And so the process starts with each agency has to submit an application to be a COVID-19 vaccinator site. That turnaround has been extremely long. So at one point, the state was several hundred applications behind. And so that has to be done first. And then you have to submit, after that's done, then you have to complete other processes, which includes making sure you're registered for Show Me Vax, which is the platform that the state is using. If you're not typically VFC providers or Vaccine for Children providers are the ones that utilize that platform in local health departments. And so having that done and then just waiting for the state's approval. And so there's still jurisdictions in the state of Missouri that have not received vaccine. And so I just want to kind of set the tone there as well, because we weren't alone with as being we weren't the only jurisdiction in the state of Missouri that hadn't received vaccine.
Okay, so it was just a matter of issues at the state, but not any issue with the application or any of the processes that the city undertook. There were no issues there.
We followed the guidelines that the state issued.
Okay. Let's see. I think I have two more questions. Appreciate your patience. Oh, can you also provide us with the list of questions? As you said that there were like a 4 or 5 step process. So there's a greeter, a screening table, then there's a clipboard consent form piece, and then the station. Do you have all of those questions written out in terms of what people should expect? I heard from some folks that there was not really much screening done at all. And so I'm curious if there's a specific protocol that folks are supposed to follow when they're dealing with residents.
Yes, there is a protocol. I can forward that to President Reed.
Okay, I appreciate it. And I think lastly, also in, just in terms of dealing with people who we know are needing to be, having somebody else drive them to a location for vaccines, or, need to have like radio ads, TV ads, things like that to touch folks. I know we have a grant from somebody to do work with clergy. So I would really encourage you to try and make sure that we're getting the word out. And also, if I have to drive my mom to the doctor and I get an email at 9 o'clock at night, it may not be likely that I can take her at 9 o'clock the next morning. So a lot of us can show up at the last minute to get a vaccine, but I think it's much more difficult for other folks. And I apologize. I did have one more question. Last one. There's been a lot of talk, and this is just me reading stories in the media about sometimes there's an ability to squeeze extra vaccine from the vials. Is that something that you've found to be true in the experience with working with the vaccines we've received so far?
And so when we partner with agencies, so we had several agencies that we partnered with during the COVID-19 vaccine distribution events. And so because of their efficiency in reconstituting the Pfizer vaccine, we're able to get an additional dose out of every 2 vials. Typically.
Okay, so we were able to take advantage of that.
Right, because the allocation was 3,900 doses, but we were able to get 4,498 doses.
Okay. That's great. And I apologize. I did have residents asking me should they sign up for the survey again if they came down and were denied when they came down to Union Station this past weekend.
No, they should not. So we used a roster on Saturday, so we were able to check those individuals who were able to receive the vaccine. We were able to check their names off. So we still have their information.
Okay, thanks so much.
Thank you.
Thank you. Alderwoman Murphy.
Most of my concerns were asked and answered. The last one, the Alderman from the 6th asked, if you were unable to attend Friday, at your allotted time, is your name still on the list, or do we need to go through it again, or will we be notified again when they're available again? That was my question. I had some people who couldn't come when they were assigned, myself included, due to an emergency, and I just want to know what to tell them to do and what should I do. Thank you.
All right. Yeah. So you don't need to resubmit a survey. We still have your information on the roster. So.
Okay. Thank you.
You're welcome. Thank you.
That's all, President.
Alderman Coder.
Thank you, President Reed. Thanks for your time, Dr. Eccles. I was jotting some notes, your original remarks. So to date, we've given out 4,498 doses. Is that right?
So so that was during the last 3 events, but we did issue 442 doses for the fire EMS department the week prior.
Okay.
Because we received vaccine from BJC.
Got it. All right. So as we sit here today, are we out of doses and awaiting more from the state?
Yes, we're expecting to receive our next allocation today.
Okay. And I'm sorry if you mentioned this, but do we know what approximately how many doses that will be?
I'm going to be 975 doses of Pfizer vaccine.
Got it. Thanks, Doc. All right. The drive-through vaccine thing, I know Alderwoman Ingrassia brought it up, and you mentioned your concerns with, if someone were to have an allergic reaction, it might complicate things. I guess maybe it's just my naivete, but I'm seeing, drive-through vaccinations happening all over the country. And I get we don't have a critical mass of doses yet, but I would hope maybe you and EMS would reconsider that position. I mean, those guys certainly have experience pulling people out of vehicles if they're having a medical emergency. And I share the concern that, going into Union Station, if you have disability issues or mobility issues, or if you're elderly and trying to really avoid being around other people, that might be a good solution. And certainly we've got no shortage of surface parking lots. So I hope down the road, as we get more doses, that's something we can revisit. On the notification piece, I know for the Saturday event, which was sort of one of our, you started using the list of the 30,000 that have signed up. What time did that email go out to those folks saying show up, Saturday morning?
I believe that went out on Friday afternoon.
Okay. Was it Friday afternoon or Friday evening? I truthfully don't know. Obviously I'm not on that list. I
don't remember the exact time, but I believe it was Friday afternoon.
Okay. And that was an email notification, right?
Correct.
Okay. and I know you mentioned you're working with, city's emergency management and everything, and I'm sure you're aware this is one of the shortfalls of this program. But I mean, we've got to get to a point, and this is probably just more of a comment than a question, but I would please ask that you guys prioritize coming up with another way to communicate to our most vulnerable population, our seniors and our folks who really need this vaccine, besides email. Frankly, you got all these aldermen here. We have a hard enough time keeping up with our email, and we're all fairly tech savvy. It's a difficult form of communication for many, especially if you have timely notifications. So I know we do calls and texts and stuff for weather related events. I'm hoping we can get to a point where we're doing that in the near future for these notifications for the vaccine. Is that something you think we're going to be able to get done?
So we're having discussions about that because one thing we want to do is make sure we have whatever solution we adopt is sustainable over time. So we don't know when the next pandemic is going to occur. We don't know the next special situation will occur where we need to really reach these target populations. So we want to make sure whatever solution we adopt is sustainable over time, so that this doesn't just go away after COVID-19.
I understand, and I would say probably phones and SMS will still be around, and just probably more reliable for some of the population we're trying to reach than sending emails, on a Friday afternoon to be somewhere on a Saturday. That's something, I think any of us could miss. If you're someone who only checks their email a couple times a week, you're most likely going to miss that notification. So that would be my other request. I don't want to get too in the weeds on, who got vaccinated on Saturday and who didn't, but just as we continue doing this, I know we're learning as we go, and it's a difficult process, but I would ask that we take another look at the drive-through and really try to figure out a more efficient way to notify, especially the elderly, on how they can get these doses. That's all I've got. And thank you, Dr. Eccles. I'm gonna have to jump in a minute.
All right, thank you, Alderman Muhammad. Alderman Muhammad. Alderwoman Boyd.
Yes, Mr. Chair. Thank you. I just wanted to ask Dr. Eccles, when they're notifying people, how are we, because from my understanding, it's a lot of county people coming in and getting the vaccine, whereas the county is offering it also. So how is that helping us if we're doing county and city?
That's a great question. So with the information that we get for an individual's complete the survey, we're able to identify if they're city residents or county residents, and we can exclude certain individuals based on different criteria. So we make sure we look at the report really closely before we send out any notifications.
Okay, and then the other thing I wanted, because I know when you had it for the city employees, they were at the Union Station. I know they had people that weren't city employees there. So are we ensuring that all our city employees are vaccinated before we start doing public people to be vaccinated?
So we're all working to make sure that city employees who meet the current eligibility criteria have access to the vaccine. But at this point, not all city employees are eligible to receive it. So we are still trying to make sure that we follow the state's guidelines. So that's one reason why, opening it up to some portions of the public who meet the eligibility criteria is critical, so we can continue to vaccinate as many people as possible while complying with the state's requirements.
Okay, I agree with the other all the people that's asking about the seniors and the mobility. And so I know in our ward, we are actually calling seniors to see who wants the vaccine and how to get them set up. And so, thanks for what you're doing, but I just know this is a crazy process for everybody. Thank you.
Thank you.
Thank you. Alderwoman Middlebrook. Alderwoman Middlebrook.
Oh, sorry. Thank you,
Oh, there
Mr.
you
Chairman. Okay, I have a lot of constituents who live in the city who gone onto my chart and they had their first round of shots that they went to DePaul and got
Woman
this
Middlebrook,
weekend, actually.
I can't really hear you.
Louder. Okay. I have several residents who have gone and got their shots. They went through my chart and they got their shot through DePaul Hospital. And so how does that affect, do you get information from the county hospitals when city residents get their vaccination there?
No, we don't. And so, if and so that's why, if we send out the notification to an individual and they've already received their first dose, then we just ask them to decline. And so that actually happened during this last week.
Okay, that's all I wanted to know. Thank you so much.
All right, thank you.
Great, thank you. Alderwoman Clark Hubbard.
Thank you. Of course, as usual, a lot of my questions have been answered, but I did just want to mention, so I had groups, like some group settings that were set up in the 26th ward at various churches, and not so much senior homes, but just like community organizations and buildings. Is there a way when we set up the, I think you said that you might have some FQHCs coming out with the group settings, can we try to set up some group settings like that, or would that be an option so I could tell them? Because these are people that we've all been concerned about in previous comments that are not so much have access to the internet or anything like that. So they went to their church and had the church member, one church member, and over all of them doing that. And so if they could get them all back together, would that be an option? Is another, or would it have to be maybe a certain amount of them to have something like that? And then other than that, I just wanted to know, just to make sure that I offer myself up like everyone else I think did, as a way to disseminate the information out to our constituents, especially our ones that are not tech savvy or not so much, don't just want to hear about it or see it on the news.
Yeah, so I think that's a great idea. And one of the things we've been discussing is, where can we have other COVID-19 vaccination events that are embedded in the community. And so by having input from the members of the Board of Aldermen, you all know your neighborhoods, know your wards better than anyone else. And so if you have any ideas or suggestions for the health department, please reach out to us. That will be an organized approach to make sure that the space that's identified meets the requirements. So we need to make sure there's appropriate space for social distancing and those things in that space. And we are open to that. So what I'll do, if you can send me an email, and then we can make an arrangement to have a meeting. And then if there's a particular site that you think will be good for having a COVID-19 vaccination event, we can do a walkthrough and then make arrangements to have an event there at some point in time.
Okay, and then if they're already applied, already have filled out the surveys, do I just still have them do it that one time, or will these be a separate set of surveys for this, like in a separate event type thing?
No, so they've already completed the survey, then they're fine, but then we would just need to know how many people, like the number of people that are coming, so we can properly prepare and allocate doses of vaccine for the event.
Okay, well, I can tell you the first thing comes to mind, of course, in the 26th ward is Peoples. And I know probably for Alderwoman Davis, we know the greatest of all time that knows how to do community distributions, Urban League. We can get them together on the highway and right in the central, right in the central quarter of kind of that part of the north side. So I'm sure we all have ideas for that, but thank you again for taking the time out to answer the questions. And any way I can be a help, please let me know.
We definitely appreciate the Board of Aldermen. We appreciate your input. So one of the things that the health department is looking to do is really engage you all more efficiently and effectively. And starting that now there's no time to do it better than the present, right? And so there's a lot of work that has to be done. There's a lot of health inequities and disparities that we're working to address in the city of St. Louis. And we would need you all's help to really make sure that we're operating in the best interest of the community. And so we appreciate the feedback that you all provide, as well as the pull-ups, as our Cure Violence folks say, you pull us up every now and then. We appreciate that as well, because we're all learning and navigating this pandemic together.
All right, Dr. Echols, so for all the information that we requested, how soon can you get that back over to me so that we can get it out to the members of the board?
I should be able to get that to you by Friday.
By Friday, okay. And then And what type of funding do you still have available for information, for disseminating information, for radio ads, for advertising? You know, what does your budget for your information campaign look like?
So our CARES Act funding, so we were very efficient in spending down our CARES Act fund. So the health department spent down our CARES Act fund by the initial deadline. We weren't sure the federal government was going to provide an extension. And they did at the last minute, but the funding was already accounted for. And so we are establishing priorities for this the current coronavirus relief funds. And so we'll be submitting that information to you all as well for approval at the appropriate time. So we'll be working with the mayor's office to make sure everything is packaged in the appropriate manner.
All right, thank you. Thank
Mr.
you.
President,
Yes.
I just wanted to ask, I remember when Alderwoman Ingracia asked for an information piece that listed the different ways that we could have people communicate to sign up. It would really be helpful if we got that, because a lot of us are going door to door now.
Yeah, we are.
And yeah,
that's part of the information he's going, Dr. Eccles is going to provide.
good, because we'll easily distribute that.
Yeah.
Okay.
All right, thank you. And I see hand is up, but we're not taking any other, questions for any non-members of the committee today. Any other questions from any other members of the committee before we adjourn?
I'll just say really quick, I saw in the chat, I was gonna put it in my email, but someone in the chat mentioned maybe the convention center could be used as well for distribution. Dr. Eccles.
Great idea.
And so that we've reached out to them and they've reached back out to us. And we have ongoing discussion with the convention staff as well as Enterprise Center. So a lot of the large venues have really opened up their doors to us. And so we're really grateful for these partnerships that have established over the last 10 to 12 months. But I really want to, before we conclude, I really want to, the COVID-19 vaccination events that were held last week, we couldn't have done it alone. And so that was a testament to the partnership that have been established by the health department over the last 12 months. And so we couldn't have done it without the Division of Public Safety, the police department, fire EMS, as well as St. Louis University, the medical providers, as well as the nursing students, the St. Louis, the National Guard, particularly the Army branch of the National Guard that provided 2 strike teams for us, and our community healthcare system, which is a medical organization that provided vaccinators and technicians for the event. And so we're grateful for everyone that participated, administering almost 4,500 COVID-19 vaccines over a 3-day period is no small feat, and we were able to do so efficiently. And so I want to say thank you to all of our partners.
All right, thank you. And I saw Alderman John Collins Muhammad had come back, but he may have yes, again. Right, Alderwoman from the 6th, you have your hand up.
Thank you, Mr. President. Dr. Eccles, can you let us know what individuals should do if their circumstances change? For example, if I get a job as a nurse tomorrow or I get diagnosed with diabetes, should they resubmit an application or do something else?
So if their status changes, they should.
Redo the application?
I would, yeah.
Okay, and so if timing's part of the filters, then they would fall to the bottom?
So for those who are in 1A, so that still pushes them up to the top, right? Because they're healthcare workers. Yeah.
Okay, thanks so much.
All right, thank you. Entertain a motion to adjourn.
So moved.
Second.
Moved by Alderman from 6th, seconded by Alderman from 19th. All in favor signify by saying aye.
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 Opposed, motion carries. Dr. Eccles, thanks so much for the information, and let me know as soon as you get the information collected, send it over to our office and we'll get it out to you.
Great, thank you so much.
Have a good day. Bye.
Bye.
Bye.